We continue to watch the ongoing situation in Canada as more people here become ill with COVID-19. Now take a look at this breakdown across the country. At this point, there are a total of 35 cases across Canada, 13 in British Columbia, 20 in Ontario, 1 confirmed case in Quebec. And we're also learning this morning that officials there are looking into another presumptive case of COVID-19. Meanwhile, globally, there are over 95,000 cases. Those numbers spread across over 80 countries. South Africa, Poland, and Bosnia-Herzegovina recently recording their first cases. Well, Dr. Bruce Aylward is a senior advisor to the Director General at the World Health Organization. He is a Canadian doctor who led the WHO's international COVID-19 mission into China last month. We are reaching out to him right now in Geneva. So, Dr. Aylward, thank you for joining us.
Thank you, Michael.
Listen, I want to begin with what may seem like a very basic question, but how worried should we be at this point? We continue to see COVID-19 popping up in different countries around the world. We have countries canceling major sporting events. We're looking at community transmissions in the United States now. Are things empirically worse now?
Well, to your question, we should be concerned about this virus. This is a virus that we've seen can spread relatively rapidly. It can cause serious illness, even death. But I think the flip side of that is we've also seen in a number of places an ability to take measures that can manage this and really reduce the impact it's going to have on the health and economy of a country.
Well, it's interesting because, just last week you were saying that you thought COVID-19 is not beyond our control. Based on what you just said, I'm assuming you still hold that belief.
Yeah, absolutely. One of the striking findings from when we were in China, and now that we're seeing in multiple other countries, is that where there's really the political will and the action, you actually can reduce the amount of transmission of this virus using some pretty old-fashioned, let's call them old-fashioned disease control principles.
Such as hand washing?
Well, the most important thing, there's different measures, and people keep asking me, we can't do what China did, but they forget what China did was educated the population, number one, made sure they knew how to prevent the disease, what the disease actually was, how to report it. And then they had the public health systems in place to rapidly find and isolate cases and find and quarantine their close contacts. And, in Canada so far, the authorities there have been doing a superb job on exactly that. That is really the fundamentals of the approach. The rest of it were add-ons as it spread and got out of control in some areas. But in most areas of the country, the fundamentals are what managed it in China.
Mm-hmm. Well, you mentioned both China and Canada, and I do want to get to both those countries a little later in this conversation. But let me go back to what you're saying about just the general education of people. Because right now, the WHO has not yet declared this a pandemic, despite its spread to a number of different countries around the world. So wouldn't declaring it a pandemic actually help in terms of getting the word out there and getting the education more broadly, perhaps even into countries that don't have great public health systems?
Well, I would hope the word is out there based on what the world is seeing. And, I think we need to use our language accurately. Pandemic is a word that really comes out of the flu world, and it usually indicates a disease that is the spread of which is uncontrollable, let's say. It's a function of the virus itself. Flu is going to move fast because of the nature of the virus. And what we found, and this is one of the big surprises, this coronavirus is different. You can actually manage its spread, and the degree to which it spreads and how it spreads in communities is not a function only of the virus, but also of the response. Whereas in flu, you almost can't get ahead of it. This one you can. That's a fundamental difference, and it provides you a window to reduce disease and save lives, and you have to act on that window.
Okay. Act on that window, and that brings me to the next point. It actually brings back the whole issue of China, because right now, there are now questions being raised about how China dealt with the first few initial cases, when it actually first knew about COVID-19. Did you see anything in your time in Wuhan that would suggest that China perhaps dropped the ball early in the game?
Well, China, the president of China stood up a month ago and said there were shortcomings in how we've managed this response, both at the outset of it and also in some terms of some of the aspects as it went forward. But People focus a lot on the problems, but the reality was this is a virus we'd never seen in humans before. We didn't know what it was. We didn't have a test for it, didn't have a name for it. We didn't have any measures to control it. And China, in the space of a month, figured all of that out in even less than a month. The big question is, could they have figured it out a couple of weeks earlier? You don't try and solve that question in the heat of a war. That's something you go back and look at when you've got this thing under control, and that'll certainly be a big part of what we do going forward. We've got to learn from every event like this.
Learn from every event. And right now I have to point out to you that on social media, and certainly every journalist in the CBC keeps getting emails from Canadians across this country asking questions about why hasn't Canada issued travel bans? Why are there not stricter protocols at airports, things like taking people's temperature once they disembark from a plane? How would you, I know you said that Canada is doing a fairly good job, but is there room for improvement here to basically make Canadians feel more comfortable that the government's doing everything it can to protect them?
Well, I'm not on the ground in Canada, and I'm not going through your airport, so I really can't second guess what they're doing. What I can look at is how is Canada doing compared to other countries with respect to rapidly finding chains of transmission and managing them. And you've got one of the best performing countries. There's been 35 different, did I hear, events or cases right now, 3 different provinces. In every one of these, the right work is being done, and you haven't got, big clusters or community level transmission. That's pretty impressive. You want to put your focus on those things that are going to make a difference. And, the point you just made, Michael, there's a lot of things that might make people feel a bit more comfortable, but they may take a lot of effort from your government and take it away from the things that make a difference. So the big thing here is public education about what really makes a difference and what they can do. The biggest thing Canadians can do right now, don't close borders and travel restrictions. At the end of the day, it's not going to work. The virus will come in. The big thing you've got to do is know the disease, know the specifics, and know what number to call and how to get tested so you can rapidly make sure this thing is not circulating any more than it needs to.
Dr. Bruce Aylward, thank you for that.
You're welcome.
And Dr. Aylward is a senior advisor to the Director General at the World Health Organization.